Hello, my dear students. I hope all of you have scored 100%. You have answered all 20 questions or 50 questions, whatever you attempted. Okay. Okay. Good afternoon. Okay. Nafis TP. Okay, Narani. Okay, let me continue. Now, first question. The answer you know very well. In case of police custody, the inquest is held by either executive or judicial magistrate. Let me go in brief again. I am going very, very fast. Police inquest 194 BNSS and magistrate inquest 196 BNSS. And here, magistrate may be judicial magistrates or executive magistrate. There are two types of magistrates. Murder inquiry is done in case of death while under police interrogation or death during police firing or lathi charge whenever a person dies in the hands of police or suspected to be died in the hands of police, or if a person dies in the police custody, or if rape takes place in police custody, or a person disappears from the police custody. Police custody means maybe in the prison authorized by the magistrate or court, like Boston school or remand home or jail, whatever it is. Number four, in case of death of a mentally ill prisoner in a psychiatric hospital. Number five, in case of a woman, married woman, dies within 7 years after marriage under suspicious circumstances, maybe by suicide or any other suspicious circumstances, to rule out dowry death. And finally, in case of exhumation. Okay. Now, previously, out of all these, if a death takes place in police custody, rape takes place in police custody, or disappearance by person in police custody, inquest has to be done by judicial magistrate. But as of today, it is not mandatory. Any magistrate can do, whether it is executive or judicial. So this is the old question. As I told that time, the answer was judicial magistrate. That in police custody only by judicial magistrate. That is previously, but not now. Not now. Remember that. Okay. And as of today, person dies in police custody, magistrate. And here the inquest is always done by a magistrate under 196 of Bharatiya Nagarika Suraksha Samhita. And coming back to the question, it is either magistrate or judicial magistrate. Number two, N block removal at autopsy is called. Don't try. The answer is Gauss technique, because I already told you many teachers are teaching block dissection and block by block dissection, or n block dissection is Gauss. It is wrong. Block by block is n block only, but actually n block means all together. Okay. Again, I repeat. Techniques of autopsy, lead tools technique means n mass means n block, meaning is same all together. Cost technique, block by block dissection, work course organ by organ, Rogatransky Institute dissection, and I gave you the proper reference by international standard textbook, that is banana n block in letules. All right from tongue to rectum, everything is taken as a single large organ block, as you see in this picture. Commonly done in medical colleges to teach undergraduate as well as postgraduate students. N-mass removal at autopsy is called Letule's technique. N-block is known as Letule's technique. And Gauss means block by block dissection, maybe cervicothoracic block, then abdominal block, urogenital block, separate organ blocks. So block by block dissection is known as Gauss technique. N-block method used at autopsy is Letule's technique. Workhorse means organ by organ removal, most commonly done in India. Rogatransky in case of suspected infection cases or known infected cases, you don't remove, you just open the cavity, don't manipulate too much. Then in infected and suspected infection cases, and you can remember, like, don't worry, GB lay, V for workhorse, organ by organ, Rogatransky Institute, and Gauss block by block, lead tools, en mass or n block. At autopsy, n block dissection means everything is taken as a single large organ block. The technique of autopsy HIV infected dead body is Rokitansky technique. N mass dissection is Letule's technique, asked in NEET 2023. N block removal at autopsy is called Letule's technique. I think all of you are written properly. Okay. Number three, fish stealing. You know very well. In case of single-edged knife or kitchen knife, The wound of entry will be exactly cross-section of the penetrating build, may be triangular or wedge shape, or sometimes raindrop shape or teardrop shape. But fishtailing. Sometimes the blunt edge of the single-edged knife may tear the skin in the shape of the tail of the fish, known as fishtailing. Okay, so fishtailing is caused by a stab by a kitchen knife. Determine the age of the individual. Now, what is your answer? What you have written? What is your answer? Let me discuss later. The answer, as you know, it is 4 years because four carpal bones, 4 years. There are 8 carpal bones. The earliest carpal bone to appear is the capitate, then the hamate. It goes anti-clockwise. Then the trichotrom 3 years, luminate 4 years, scaphoid trapezium trapezoid 4 to 5 years, and lastly the pisiform 9 to 12 years. And at the age of 1 year, there will be 2 carpal bones. 2 years, there will be 2 carpal bones. 3 years, 3 carpal bones. 4 years, 4 carpal bones. 5 years, 7 carpal bones, and 12 years, all 8 carpal bones. And you know how exactly to differentiate whether pisiform is appeared or not, because always there is overlapping. Overlapping, you can see the because of the double density, you can see a line of demarcation as I shown in arrow. Look here. By that, you can say whether pisiform appeared or not. Which of the carpal bones is first to ossify is capitate, Ames November 17. What is the predicted bone age? Now here, all the bones appeared except pisiform. So answer is less than 15 years. Okay. Maximum age, anyway, same age is less than 12. So 13 can be ruled out. The answer is 10 years. Determine the age of the individual. Now there are only 3 carpal bones. The answer is 3. Determine the maximum age. Only 2 carpal bones. The third one is supposed to come in trichotrom. Trichotrom comes in 3 years. So maximum age can be 2 years. 2 years. Okay. Meantime, look at this. No carpal bones at all. Less than 2 months. So here the best answer is less than 1 year. Okay. Determine the age of the individual. You can say capitate, hamate, trichotrom, and lunate. The age is 4 years. Coming to the question number 5, the incision preferred during autopsy. This again controversial question I said. What is the answer you have given? You have given Y shape. Yeah, that is right because skin incision used in autopsy. Number 1, I shape, most routine incision. Symphysis is mentile to symphysis the pubis, avoiding the umbilicus, most common and routine incision. Y-shaped incision from both nostrils down to the sternum notch, down to the pubis symphysis, avoiding the umbilicus, it is done in neck injuries and asphyxiate death by compression over the neck. This is the picture as I showed, the Y-shape, Y-shape, Y-shape. You can expose the neck properly. Modified Y usually done in females for cosmetic purpose, both acromion away from the breast, below the breast, to reach the exempt sternum and down to the pubis symphysis, avoiding the umbilicus, done in females for cosmetic purpose. Again, many people ask why cosmetic in a dead body. Always you should present in a presentable way. Okay. Now, this is the modified Y where, as I said, the incision will not be seen. In case of males, we can close it. But in females, because of sari blouse or salwar, you cannot close it. That's what you can go for. Modified Y-shaped incision. Okay. Controversy I told, I don't want to spend my time. This is my reference from question which you can pause it and see later. At the same time, Banana I told clearly that Y-shaped incision in hanging, strangulation, or where the larynx might be damaged, that is in case of neck injuries. X-shaped incision in case of suspected torture, you are removing the skin of the entire body because sometimes there may not be any external injury. On cutting open, you can see a lot of contusions in the muscles. So the incision used during autopsy in case of asphyxiate death due to neck compression is Y-shaped incision. Now, what is your answer here? Tell me. Identify the range of gunshot injury by the image given below. What is your answer? What have you written? Close shot. Yeah, you're right. Again, I repeat. The products of firing, as you see, you can see the flame. Along the flame, there will be hot air. And once the gunpowder is burned completely, it gives rise to soot and smoke. And some amount is partially burnt or unburnt that give rise to the tattooing and bullet. Now, what are the products of firing? What are the effects? The flame and hot wind give rise to burning of the skin and burning of the hair, that is known as singeing. The soot causes blackening or smudging. The powder particles just penetrate into the epidermis, get embedded in the dermis, give rise to tattooing or peppering or powder stippling. The bullet give rise to wound of entry. Along with that, there is abrasion collar and grease collar. In firearm injury, tattooing is noted on the wound of entry. What is the cause of tattooing? As you know, unburned gunpowder particles. And blackening is due to smoke and soot and different ranges. Now, you see, number one, the person is in touch with the muzzle end of the gun, that is contact shot. If the victim is away from touching the muzzle but within the reach of the flame, it is known as close shot or close range, more than touching the muzzle but within the reach of the flame. Near shot means the person is away from the reach of the flame but within the reach of the smoke and soot. Intermediate means the person is away from the reach of the smoke and soot but within the reach of the powder particle. Distant shot means he is away from all other products of firing except the bullet. Now, if the person is in distant shot, only the bullet touches, you get wound of entry along with grease collar and abrasion collar. If it's in intermediate, in addition to that, there will be tattooing. In case of near shot, in addition to wound of entry and tattooing, there will be smudging or blackening. And if the person is in close shot, you see the wound of entry with grease and abrasion collar, plus tattooing, plus blackening, plus burning of the skin and burning of the hair. And contact shot, I explained later. Now coming to the distant shot, I told there is wound of entry surrounded by grease collar and abrasion collar. This is the actual picture. You see only the wound of entry with the abrasion collar, but there is no tattooing, no blackening, no burning, nothing. Only abrasion collar around the wound of entry is caused in case of distant shot. Ask in INI-CET May 23. The intermediate, as I told, in addition to the wound of entry, there is tattooing. This is the actual picture, what you see. Okay. You see the difference between distant shot and intermediate shot. Only wound of entry in case of distant shot, but in addition to that, tattooing in case of intermediate range. And here, wound of entry with abrasion collar and inverted margin surrounded by tattooing without burning and blackening, it is intermediate shot. And here again, you can see the wound of entry just above the mid eyebrow, but surrounded by the tattooing, it is intermediate range. Identify the range. Answer is pistol, intermediate range. And here there are no signs of burning, singeing of hair or charring, but tattooing is present around the wound, intermediate range, only tattooing. Now come to the near shot. In addition to the tattooing, you see blackening, as you see here. That is near shot. Now again, I show you the difference. Distant shot, only wound of entry. Intermediate, in addition to that, there is tattooing. Near range, in addition to that, there is blackening. Only tattooing and blackening around the wound are seen in near shot. Identify the range of gunshot injury by the image given below. You can see the blackening with tattooing near shot. Close range, as I told, in addition to that, the burning of the skin, burning is also known as scorching, or burning of the hair is known as singeing. This is what you see exactly in the question. All of you have answered as close range. Close range. You are right. And now we can see the difference between all these. All these. Okay. Contact shot may be firm contact, or tight contact, where there is indentation of the skin. Entire products of firing will enter into the wound bag. What you see is only the muzzle impression. Muzzle impression. Loose contact means there is no indentation of the skin. When the bullet is penetrating by causing invagination, there will be a gap. Through the gap, the flame, the hot air, as well as the smoke and soot may escape and deposited around the wound of entry known as corona. The findings are abrasion plus grease collar, blackening, burning, singeing, and muzzle impression is unlikely because it is not tight contact. Now you see how to differentiate between loose contact and near shot, there is tattooing, loose contact, only black. Corona is seen in loose contact. Full contact, there is an angle, the local gap to the gap, everything will escape the bullet, and your tattooing is seen in an overt manner along with blackening. So what you see is the blackening, tattooing, burning, singeing, and partial muzzle impression in angled contact. Meantime, in case of bony areas like head and sternum, because of the loose tissue, loose areolar tissue, and a loose subcutaneous tissue, gas get escape between bone and skin and forms a temporary bulge. As soon as the gun is fired, he dropped the gun. The collected gases try to come out through the same wound of entry forcibly, which give rise to tearing of the skin irregularly, give rise to cruciate or stellate wound of entry, large irregular wound will be seen. It is the only exception. Large irregular entrance wound is seen in contact shock. Stellate wound may be seen in contact shock. Cherry red discoloration may be seen whenever smoke comes in contact with the wound. So, when the smoke contains carbon monoxide with hemoglobin, it forms carboxyhemoglobin, seen in case of contact shot, close shot, and near shot. So, all these together in a single frame. So, whenever the wound says that cruciate in shape, your answer should be contact shot. So, now all of you have answered. The answer is close shot. In India, custody rape is punishable under section, you know very well. 63 BNS defines what is rape. 64 punishment for rape. 64 1 minimum 10 years to maximum life imprisonment. Of course, maximum life, not death sentence. But 64 2, which includes custodial rape. Rape by a person who is in a position of authority, taking advantage of his official position to rape a woman in his custody. Rape in custody. Remember, custody rape is rape in custody. Okay, minimum 10 years. You have go to life imprisonment means till his death, he should be there. Till his death. There is no reduction after 14 years. He will not be released. Quantum of punishment means minimum is 10 years. Custody rape also minimum 10 years. 67. It is not marital rape. When the judge passes an order of keeping husband and wife in separation during divorce suits, then, if the husband goes and has sexual intercourse without her consent and if she complains, it amounts to an offense which is cognizable and valuable, minimum 2 years, maximum 7 years. It is not marital rape because word itself is sexual intercourse, not rape with the wife. Okay. In India, there is no marital rape. Section 68. Sexual intercourse by a person who is in a position of authority, taking advantage of official position to seduce her induce any woman to have sexual intercourse not amounting to rape. It is not custodial rape. Some teachers teach this, or even some books mention this is custodial rape. It is not at all rape. Okay. Here, woman is given consent for some kind, or the person offers some kind. Okay. Minimum 5 years, maximum 10 years of imprisonment. For example, you see what exactly the difference between 64 2 is custodial rape, 68 is not custodial rape. It is sexual intercourse not amounting to rape. I gave you 2 examples already. I have discussed all this. Here, a woman has been raped in the police custody. So, answer A, 64 2. But in this case, a final student had attendance shortage, where the principal offered attendance in return of 6. It is punishable under section 68 of Bharatiya Nyaya Samhita. In India, custody rape is punishable under section 64 2. All the following are the signs and symptoms of acute cocaine poisoning. Let me discuss on cocaine poisoning because it's very, very important. Cocaine is also known as wet lady. It derived from Erythroxylum coca. You can see like a small chili. Okay. Method of drug abuse is by snorting. As you see, you just track deep inside the nostril. Trap means smokable form of cocaine by adding baking soda and water and dry it and fill it into the cigarette. And when it burns, the burning particles may come and sit on the cornea, give rise to corneal defects known as cracked eye. Cracked eye. Because of the snorting, there is nasoceptal ulceration and perforation of palate. Meantime, it gives rise to black tongue and black teeth with grinding of the teeth, known as bruxism. A condition called formication means tactile hallucination. Tactile hallucination means person feels some sun grains under the skin or some insects crawling over the skin. And it is seen only in chronic consumption of cocaine. Remember that. And cocaine Specifically, the formication in cocaine poisoning known as Magnum symptoms or coke bugs or cocaine bugs. And it occurs together with delusion of persecution. When it happens specifically in amphetamine, it is known as mechmites. Mechmites means tactile hallucination in amphetamine poisoning, chronic amphetamine poisoning. Now, it is also seen in case of alcohol withdrawal, arsenic poisoning, and gut poisoning. Okay. Excited delirium, everything is increased. There is tachycardia, tachypnea, hypertension, hypothermia, agitation, and incoordination. Because of already it is a delirious poison, but it gives rise to more double delirium. Okay. And because of all this, there will be numbness and tingling in the hands and feet. People are always dilated pupils. So many times they ask in the examination, Magnus symptom is seen in poisoning with cocaine. Magnus symptom is seen in case of poisoning by cocaine. No suggestion of cocaine poisoning is bradycardia. A person tachycardia, tachypnea, increased BP and scratch marks because of tactile hallucination. Answer is cocaine. Not a feature of cocaine intoxication is constricted pupil because it causes dilated pupils and tachycardia. All the following are signs and symptoms of acute cocaine poisoning during stage of excitement. Exact. You don't see cocaine bug. Cocaine bugs are seen only in chronic poisoning. Okay. Chronic cocaine brought to the ER with alleged history of feeling of insects crawling on the skin. Formication is known as tactile hallucination. 30-year-old female has presented to the emergency room with dilated pupil, tachycardia, hypertension, agitation, diaphoresis means increased sweating, cocaine poisoning. All the following are seen already. I discussed. The answer is cocaine box. Okay. Identify the type of the injury. Okay, let me tell. What do you answer for this injury? What is the injury? Laceration inside, chop, wound, or stab? Chop. You're right. Now, if I throw a stone on a person, it gives rise to a lacerated wound. Lacerated wounds are caused by blunt weapons where the margins are irregular, edges are abraded because side of the stone come in contact with the edges of the wound. Whereas neurovascular bundles which are made up of elastic tissue will not get transected. So neurovascular bundles are intact. Meantime, if I take a blade and cut the skin, look here, identify the injury. You can see the neurovascular bundles. The answer is lacerated wound. And if I take a blade and cut, it gives rise to incised wound. The length is the maximum dimension. The margins are regular and edges are not contoured. Neurovascular bundles are not intact because sharp blade cuts the neurovascular bundle cleanly. Okay. Meantime, if I take an axe and hit a person, the sharp edge of the blade will cause regular margins, but the invaginated skin, because of the heaviness, the side of the blade comes in contact with the skin, which give rise to abrasion or bruises at the edges. Neurovascular bundles are not intact. Chop. Identify the injury. The margins are regular, edges are abraded, no neurovascular bundles. Answer is chop. Identify the type of the injury. Laceration. Neurovascular bundles are intact. Margins of the wound was cut clean. Underlying tissue are crushed with disrupted bony margins. Answer is chop. Identify the type of the injury. The answer is chop. A person giving false evidence under oath will be punished. The court of law. If you believe in the God, you have to take oath. If you don't believe in the God, you have to go for solemn affirmation. In the name of the God, I swear that I will tell the truth, the whole truth, and nothing but the truth is known as oath. I solemnly affirm that I will tell the truth, the whole truth, and nothing but the truth. That is known as solemn affirmation. If a person lie under oath or solemn affirmation, then it is known as perjury, which is defined under section 227 of Bharatiya Nyaya Samhita. Fabricating false evidence is defined under section 228 of Bharatiya Nyaya Samhita. Both 227 and 228 BNS are punished under section 229, maximum 7 years of imprisonment. Whereas 35 defines and punishes issuing or signing false certificate. False certificate. Now, Here, the answer is 229 of Bharatiya Nyaya Samhita. Okay. A 40-year-old woman with an allegation of sexual assault has come to the obstetrician for termination of pregnancy with 22 weeks of gestation. In such case, what is the true statement? True statement. Okay. Again, opinion of one RMP up to 20 weeks, 20 to 24 weeks, opinion of two RMPs. What are the grounds? In case of contraceptive failure in a man or a woman, married or unmarried, only up to 20 weeks. Whereas up to 24 weeks in case of rape, in case of forcible sexual intercourse by husband with the woman, and if she becomes pregnant, it is not a marital rape, but termination can be done after 24 weeks. Number two, in case of incest. Number three, in case of minors. Number four, if the woman becomes widow or divorced during the course of pregnancy. Number five, in case of woman with physical disability. Number six, in case of mentally ill or mentally retarded woman, or in case of fetal abnormalities, or in case of humanitarian settings as announced by the government. Even after 24 weeks, in case of substantial fetal abnormality diagnosed by a medical board, but the medical board consists of an obstetrician, a pediatrician, a radiologist, and any other doctor nominated by the state government. FTP can be done anytime, even just before the full term, if the continuance of pregnancy endangers the life of the woman with the purpose of saving the life of the woman. Now, here, opinion of one doctor is sufficient wrong. MTP can be done up to 24 weeks is right. Okay. MTP cannot be done is also wrong. MTP can be done only if the life of the mother is in danger. That is also wrong. Now, coming to the question number 12. A patient died of bronchopneumonia. What is in 1C? Yeah. Again, because already you have heard my class so many times. If I repeat it, may be boring for you. That's why I'm going very fast. Am I going very fast? I don't think I'm going very fast because all these are revision. The only revision. Cause of death, Roman 1, immediate cause A, antecedent cause B, C, D. Number 2, other significant causes. Don't ever write heart failure, asthenia, respiratory failure, respiratory arrest, cardiorespiratory arrest. Don't write all such words. You have to write exactly the disease or injury or complication which caused the death. 1B, which is given rise to 1A should be 1B, which is given rise to 1B should be 1C, which is given rise to 1C should be 1D. And Roman 2, contributing the death but not directly related to the disease or condition causing it. I will explain later. Now you see there are 4 generations. Imagine the last one is 1A, the baby is 1A. A 1A is due to 1B, due to her mother. Her mother 1B is due to her mother. Her mother means baby's grandmother. She is 1C. And 1C due to 1D. She is the baby's great-grandmother. As I told you, what comes last? The last who came is the small baby. It should come first in the MCCD. Meantime, what comes first? That is grandmother. 1D should be the last. A person died of septicemia due to peritonitis as it is a perfection chronic answer. The immediate cause of death is septicemia. Septicemia due to acute peritonitis. Acute peritonitis is due to the perforation of the duodenum. Perforation of duodenum is due to chronic duodenal ulcer. In addition to that, if at all the person is having diabetes mellitus or hypertension, he can write it to number 2. Myocardial infarction as a result of coronary occlusion, as a consequence of atherosclerosis. Immediate cause of death is myocardial infarction due to coronary occlusion and as a result of atherosclerosis, diabetes, hypertension. Died due to lobar pneumonia. 1A, lobar pneumonia. 1B, measles. 1A, uremia due to chronic bilateral renal failure, due to hypertension, due to polycystic kidney disease. Now, answer, Last, immediate cause of death is bronchopneumonia, that is due to intracerebral hemorrhage. Intracerebral hemorrhage has given rise to hypostatic pneumonia. Hemorrhage is due to rupture of the cerebral metastasis, squamous cell carcinoma of left main bronchus. The following picture depicts, what is this? Tell me, what is this? What's the answer? B. Tentative cuts. Yeah, also known as hesitation cuts. Before gathering sufficient courage, the person may go for multiple small superficial hesitation. The cuts, known as tentative cuts or hesitation cuts, it indicate suicidal manner. May be seen only in cut wrist injury and cut throat injury. Up. Fabricated injury, as I told, is also known as forged injury or invented injury, may be self-inflicted, may be asked by some of his friends, maybe to gain sympathy or out of frustration or for false allegation. For false allegation, maybe by himself or may ask his friends to inflict on his body, maybe to accuse some of his enemies to support a false charge with ulterior motive or to avert suspicion. Means if the security personnel collude with the robbers, he only may help the robbers, but later he may go for some injuries and trying to tell the police stating that he was defending while people are robbing. Fabricated wounds are mostly incised wounds. All these, the front aspect may be self-inflicted, back aspect may be made by his friends. All these, which is not seen on the wrist and throat, are fabricated injuries. Defense wounds when trying to prevent assault, to ward off the assault, defense cuts. Whether it is imprint abrasion or pressure abrasion, if the pattern is produced, we call it as pattern abrasion and it is the best term to use. Okay. The following picture depicts tentative cuts. The conclusive evidence of death due to drowning. What is the answer? What is the conclusive evidence of death due to drowning? No, you are right again. Number one, cadaverous pause with weeds or grass in the hand. Number two, emphysema posum, enlarged lung that give rise to copious amount of white fine leathery fur. Number four, fault of hemorrhages, which is seen in about 50% of cases due to rupture of the alveoli, which is seen in the subpleural space, most commonly seen in lower lobes, very, very small to 3 to 5 centimeter in diameter. Okay, fault of hemorrhages. Fault of hemorrhages seen in death due to drowning. That Mutual import is always controversial, as I told. If I drink water from my well, same well, that atoms will be in my body. If I jump into same well, it does not have any medical importance unless I jump into the well of my neighbor's. That time, if the where I never drank the water of my neighbor's well, if that atoms are found in my blood, or not sorry, blood, my bone marrow, or any organs, then only it is diagnostic. Okay. So conclusive evidence is none of that. Not associated with saltwater drowning is. There are two types of drowning, seawater drowning and saltwater drowning. In both, there may be disruption of pulmonary surfactant. In freshwater drowning and saltwater drowning, the mechanism is osmosis. Water passes from low concentration to higher concentration. Water from lungs enter into blood because there is no salinity in the fresh water. Water enter into blood, which give rise to hemodilution, which indeed give rise to dilutional hyponatremia. That causes swelling of the RBC, rupture of the RBC, hemolysis, releasing potassium, hyperkalemia, ventricular fibrillation, death in about 4 to 5 minutes. Sort of drowning, water from the lungs, water from the blood enters into lungs, give rise to a lot of pulmonary edema. Meantime, there will be hemoconcentration, that is concentrical hemoconcentration, concentrical hypernatremia, which in turn give rise to bradycardia, cardiac arrest at death in about 8 to 10 minutes. So hemolysis is not seen in salt water. Dilutional hypernatremia is seen. Hemoconcentration is sorry, hypernatremia, concentrical hypernatremia is seen in salt water. Hemoconcentration is seen, bradycardia is seen, not the hemolysis. What is the false statement regarding snake? Hospital treatment, wait and watch for symptoms. If indicated, begin PSV with 10 vials effective against big bees, common cobra, common crate, Russell viper, small scale viper. But Hopkins Institute or Hopkins Pharmaceutical Company, PASV, may neutralize the venom of pit viper. The toxins get fixed in the prosynaptic region in case of common cobra. So neostigmine has to be given, whereas common crate, as it fixes in presynaptic region, no need to give neostigmine. That's why PSV may be given in pit viper, but it may be given. Cobra toxic, you know very well, whereas viper is vascular toxic. Alternative medication should be used before administration of neostigmine. Neostigmine has a role in crate bite is wrong. Now, what is the answer here? Which after the admission of atropine, which one of the sign and symptom will not change? What is the answer? Yes, all of you have written, muscarinic manifestation and nicotinic manifestation. Here you get meiosis, bradycardia, and hypertension, salivation, sweating, lacrimation, urination, defecation, gastrointestinal cramping, emesis. All these muscarinic manifestation. Nicotinic mainly fasciculations and which affects the muscles where you get muscle weakness, diaphragmatic failure, respiratory paralysis, hypertension, tachycardia, pityriasis, pal. Always muscarinic predominate over nicotinic manifestation. And specific treatment for organophosphorus is atropine. Atropine is counteracts only muscarinic effects, not the nicotinic effects. Role of enzymes is controversial. It is supposed to be cholinesterase reactivators. So here, sweating, lacrimation, bradycardia, muscarinic effects, but atropine will not counteract muscle weakness. Causing death by rash and negligent act by a doctor is dealt under. See, Section 125 of Bharatiya Nagarika Nyaya Samhita and 106 deals with rash and negligent act. 106 causing death by rash and negligent act, maximum 2 years of imprisonment. 114, defines what is hurt. 116 defines what is grievous. 125, rash and negligent act endangering the life of the person or causing hurt or causing grievous hurt. 125. Okay. So answer is 106. In case of kleptomania, whether he is criminally responsible for his act or not. Now, look here. I told you, you asked two questions. Number one, does he know what is he doing? If no, not liable. If yes, does he know what he is doing is right or wrong? If no, not liable. If yes, liable. And there is no diminished and partial responsibility in Indian law. So in kleptomania, person knows very well what is he doing. He knows very well what is he doing is wrong. So he is liable. Malaria is not liable because he does not know what is he doing. Automatism again not liable because he does not know what he is doing. Epilepsy he does not know what is he doing. Somnambulism, first offense is liable, subsequent offense is not liable because once he committed a crime after first attack, he should take precaution of himself. Hypnosis, both are liable, hypnotizer and hypnotizee, because nobody can hypnotize without their consent. So here he is criminally responsible for his act. Identify the following. Everything is pink, pink hands and pink feet. See, in case of mercury poisoning, also known as pink disease, or ectrodynia, swift disease, shelter disease, fear disease, painful, paresthetic, peeling, perforing, pink hand, puffy, hands and feet. Usually it is affected in children, but recent journals say adults also it can be seen. So acrodynia is seen in case of mercury poisoning. So all these are streamed in the YouTube also. So, how many questions you are right? Tell me, out of 20, how many questions you are right? How many questions you are right? Or how many answers are right? Tell me. You're not messaging only. All good. Congratulations. What about others? Only Sharon? 18. That is also good. Anything more than 15 is good only. Okay, don't worry.